Okay, let's unpack this therapy notes. They're usually this incredibly private, deeply subjective window into a clinician's mind as they work with a patient, right? They capture observations, interpretations, feelings about the session.
Absolutely. Very personal stuff.
But what if, and this is the interesting part, what if a computer could read those notes, not just scan for keywords, but actually analyze the style of the language, used the subtle patterns of how thoughts and feelings are expressed.
Right.
Tell us something objective, something surprising about what's really happening in the treatment.
That's the fascinating premise of the source material we're diving into today. It's a study that took archived psychoanalytic treatment notes, often seen as some of the most subjective clinical writing out there, and subjected them to computerized text analysis.
And our mission in this deep dive is to explore exactly what these objective linguistic measures uncovered. How can analyzing language style potentially reveal hidden dynamics, spot critical turning points, and maybe even offer clues about why some therapies succeed and others don't, looking at cases from the archives?
It's an attempt to bridge that historical gap, between the scientific study of mental health and the intensely personal practice of therapy.
Okay.
By using ubiquitous clinical notes as a data source, they're trying to bring systematic study to material previously seen as too qualitative or, subjective.
And the method they used is pretty clever. It focuses on the how of the language, the style, rather than just the content.
That's right.
The study zeroes in on two key linguistic measures.
Exactly. The first is referential activity, or RA, specifically using a measure called mean high W rate, or MHW.
MHW, okay.
This measure is designed to capture how connected language is to vivid sensory experience and emotional processing. Think of high RA language as being really vivid, imagistic, and detailed.
So if a therapist is writing notes about a patient describing a memory, high MHW language in those notes would feel like you're right there with the patient in that moment.
Yeah, sort of.
Full of concrete details, sensory descriptions, using words like the, in, and that tie the experience together.
Precisely. It's language that reflects being immersed in the emotional experience. Low RA is more abstract or generalized.
Okay.
MHW specifically flags periods where this kind of vivid, emotionally connected language is most prominent in the notes.
Okay, and the second measure is reflection, or REF.
REF looks for words associated with logical functions. Thinking words such as if, but, think, believe, reason, cause. It suggests a move towards regulating emotions, analyzing, or perhaps creating distance from the raw feeling.
So if MHW is the therapist's notes reflecting living the experience, REF is the notes reflecting thinking about the experience, or maybe even putting some cognitive distance on it.
That's a good way to understand it. And the real key for the study was the difference between these two measures, the MHW-REF difference. When MHW is significantly higher than REF, meaning a high positive difference, it suggests intense emotional engagement reflected in the notes, living in the experience, as the source puts it.
And a low or negative difference, what does that suggest?
That would imply less emotional intensity in the notes, more distance, perhaps containment of affect, or possibly avoidance.
Got it. So the computer is essentially tracking this subtle balance within the analyst's own writing about the sessions.
Yeah.
How much it reflects vivid emotional engagement versus intellectual reflection or distancing.
Exactly.
The study sample included 14 cases from the New York Psychoanalytic Society and Institute archives with treatments dating from the mid-20th century onwards.
Right.
Current clinicians rated the outcomes using standard measures like GAF and PFS. Those are scales that give a picture of overall functioning and symptom severity.
Yeah, standard tools.
Combining them into a composite clinical evaluation, or CCE.
And the initial finding from that larger sample was really thought-provoking. Higher MHW in the analyst's notes across the whole sample correlated with better CCE outcomes.
Wow.
The cases where the analyst's writing felt more vividly engaged tended to be the ones where the patient ultimately did better.
Think about that for a second. The analyst's writing style, how emotionally connected they were in their notes, seemed to predict how well the patient fared.
Yeah.
That alone is pretty striking. But the real power of this approach is looking at the trajectory within individual treatments. Let's dive into case study 1. Patient 50T1.
Okay. This was a professional man in his late 30s. What's notable is that the initial assessments by experienced evaluators were extremely positive.
Really?
Yeah, he was seen as an excellent and worthwhile candidate with an excellent prognosis. Everyone expected this to be a successful treatment.
Yet the outcome was the opposite.
Exactly. The treatment ended after just 22 months and was rated unsuccessful, with actual measured declines in GAF and PFS scores.
Oof, declines.
Yeah. Clinicians later saw it as a failure, describing the patient as having a severe ego disturbance and being unable to examine himself objectively.
So clinically, it went badly despite the initial optimism. What did the language scan of the analyst's notes show for 50T1? Looking at what the source describes in Figure 1.
Well, in the early phase, the REF score in the notes was slightly above MHW, suggesting a mild degree of intellectual distance or regulation.
Okay, a little bit distant.
Then the difference narrowed over the next period, getting very close to zero in spring 1952. This seemed like a moment of potential change or increased engagement starting to happen.
Okay, so the language was becoming less distant, more balanced between reflection and engagement. What happened after that brief period in spring 1952?
This is the crucial moment the scan highlights. After spring 1952, the MHW score in the analyst's notes sharply declines, while the REF score increases, almost in a mirror image.
A mirror image, wow.
Yeah. The negative MHW-REF difference grows larger and stays there. The computer is flagging a significant shift towards less emotional engagement and more intellectual distance in the analyst's writing about the treatment.
So the scan suggests the analyst was somehow pulling back, becoming less connected to the vivid emotional world of the patient in their notes.
That's what it looks like, yeah.
How did this pattern in the language align with what the notes actually describe happening clinically?
Well, early in the treatment, the patient was expressing anger at the analyst's youth, questioning his experience in tense stuff related directly to the analyst.
Right, the transference.
But the analyst's notes at the time seemed to bypass this, maybe changing the topic or asking for more factual details about symptoms.
Avoiding the immediate emotional heat, especially directed at the analyst.
Right. Fast forward to spring 1952, that period where the scan showed MHW and REF converging. The notes from that time described the analyst engaging more directly. The analyst communicated an understanding of the patient's conflicts, linked the patient's concern about an upcoming vacation to fear of needing the analyst, and connected the patient's fear of dependence to feeling less manly. The patient also shared significant history. The notes mention the analyst touched on the transference, the patient's feelings and reactions towards the analyst.
So during the period, the scan shows the analyst's notes becoming more emotionally engaged. The notes describe the analyst actually engaging more directly with the patient's feelings about the analyst and the relationship. That connection is really interesting.
It is, but here's the twist. Even in those notes from spring 1952, the analyst also calls the patient's focus on transference a digression.
A digression. A digression from what the analyst thought they should be talking about.
That seems to be the implication of focus on content over the process, the relationship itself.
I see.
And then, as the scan shows the MHW plummeting and REF rising dramatically after the summer break in summer-fall 1952, the notes indicate a shift in the analyst's focus. The analyst doesn't report addressing the patient's upset about the break or his denial of closeness dependence.
Oh.
Instead, the notes dwell on the patient's provocative remarks, aggression, other thematic content.
So the analyst seems to be focusing on the patient's behavior and certain themes, but the notes don't reflect them engaging with the underlying emotional meaning of that behavior, especially as it relates to the relationship with the analyst.
Exactly. The source points out an example where the patient brings another patient to his room. The analyst's note focuses on this being provocative to the analyst. Rather than exploring the complex meaning for the patient, perhaps it was a displacement of need or anger towards the analyst. The analyst seemed focused on their own reaction rather than analyzing the patient's inner world and relational dynamics.
It sounds like the clinical approach described in the notes mirrored the linguistic shift seen in the scan, moving away from that vivid emotional engagement with the core relational issues.
That seems to be the compelling link. At termination in spring 1953, the analyst finally confronts homosexual thoughts and defenses directly, but the notes add that supervision decided to terminate soon after because the patient seemed unable to tolerate it.
Which, as the source speculates, makes you wonder how the context of the times regarding homosexuality and the influence of supervision might have played a role in that outcome.
It certainly adds a layer of complexity and raises questions about external influences.
Sure.
But the potential insight from the language scan is powerful.
Yeah.
It flagged a problem, the analyst's language becoming less emotionally engaged before the clinical picture of failure was fully evident.
Right.
The shift in the analyst's notes, and presumably their clinical focus towards less emotional engagement, seemed to occur when they struggled to address the patient's need for closeness and those challenging transference dynamics, particularly around dependence and potential feelings towards the analyst.
So the computer analysis provided an objective flag that something critical shifted in the analyst's processing of the material, coinciding with the clinical work getting stuck on defensive behavior rather than exploring the underlying relationship issues.
That's the picture it paints.
Let's contrast that with case study 2, patient 70T3, a successful outcome.
Okay. This was a married professional woman in her early 30s suffering from recurrent severe depressions.
Okay.
Interestingly, her initial evaluations were mixed. Some saw her as a difficult second or third case, questioning her analyzability, partly due to a history of acting out.
Oh, interesting. So, unlike 50T1, the prognosis wasn't initially seen as excellent.
Not at all. Kind of the opposite, actually.
Yet she had a good outcome.
Yes. Treatment continued for 5 years and 9 months and was rated successful with solid increases in GAF and PFS scores.
Right.
She finished feeling satisfied with a much more nuanced understanding of herself and her family dynamics.
Let's look at the language scan trajectory for 70T3 then. What did the computer find in the analyst notes here, referencing figure 2?
Well, in the beginning, the scan showed high MHW and a strong positive MHW-REF difference, indicating high emotional engagement in the notes right away.
Okay, started strong.
This declined over the next period, and like 50T1, there was a phase from October 1972 through March 1973, where MHW dropped below REF, resulting in a negative difference score.
Oh, okay.
The source identifies this as a nodal period, similar timing to where 50T1's charts started going downhill.
Okay, so a difficult phase, reflected in the language becoming less emotionally engaged, showed up in the successful cases notes too. But here's the key difference. What happened after this dip for 70T3?
Unlike 50T1, after this decline, the MHW recovered significantly.
It came back up.
Yes. It returned to a level higher than REF in September 1973 and remained elevated for years. There was a dip later when termination was discussed, but the scan showed recovery again, leading into the successful conclusion.
Wow.
The computer is flagging a period of difficult engagement, but then a recovery back to a more emotionally vivid mode in the analyst's notes.
So, the scan shows the analyst's language recovered its emotional engagement after a dip. How did the clinical notes reflect what the analyst was doing during that period of recovery?
In the beginning phase, with high MHW, the notes describe the patient's anxiety but also her engagement. She was expressing rage, feeling uncared for, demanding the analyst's availability, starting to engage with transference issues.
Right.
The analyst's notes were described as having vivid language themselves, suggesting they were actively immersed in the material.
That fits the initial high MHW. Okay.
Then, during that October 1972-1973 dip, where MHW was below REF.
Yeah, the tough patch.
The patient was talking about difficult family history, wanting closeness for protection, feeling guilty. Notes show her wanting to feel she was doing analysis herself, suspicious of the analyst's interpretations, seeing them as challenges to her competence. She even threatened to leave. The analyst's notes reflect this difficult negativism, a real challenge to the connection.
So the scan picked up on that challenging, potentially disengaging phase for the analyst. How did the analyst navigate out of it, coinciding with the MHW recovery?
In the period of MHW recovery, April-September 1973, the patient's negativity, continued envy, competitiveness, but the analyst's approach shifted significantly.
How so?
There's an example where the patient expressed angry defiance about wanting another child, saying, "Women just have third children to get away from themselves."
Okay, clearly defensive anger.
Right. The analyst directly addressed the defensive nature of the anger in a way the 50T1 analyst seemed to avoid. The analyst said, "If you are so angry, you must be upset about something."
So instead of focusing on the content, having a child, or reacting to the provocation, this analyst interpreted the function of the anger that it was covering up other difficult feelings.
Precisely. This intervention helped the patient start to grasp the idea of mixed feelings.
That makes sense.
Later, approaching the summer break, the patient expressed anxiety about pregnancy, which masked how much she was going to miss the analyst.
More underlying need for connection emerging.
Yes. And when she returned in fall 1973, still struggling with the separation, she talked about moving, saying analysis wouldn't make her stay.
Pushing away again.
Exactly. The analyst saw this denial of need and gently reminded her This was similar to her response the previous summer, connecting it to her difficulty experiencing warmer feelings about the analyst. The patient reportedly laughed, and the feelings subsided.
So the analyst interpreted the patient's defense against needing them, implicitly saying, I know you need this, I know this relationship matters to you, which the source notes was like asking her to stay.
Exactly. This pattern continued. Later, as termination approached, the patient expressed mixed feelings about leaving, wanting the analyst to ask her to stay, but protecting herself by insisting she was the one who wanted to leave. The analyst was able to interpret this defense as well, linking it to earlier relationship issues. The analyst consistently understood and communicated the patient's need for closeness and engagement, even when the patient's defenses were active.
It really highlights the contrast. The language scan seemed to show the analyst in the unsuccessful case pulling back from engaging with the patient's core relational needs and defenses in their notes.
Yeah.
Whereas the analyst in the successful case, after a challenging dip, seemed to recover that emotional engagement and actively work with those exact dynamics, leading to a different linguistic pattern and clinical outcome.
That's the striking comparison the study presents. The computerized language measures, based on these specific variables, pointed to critical periods in both treatments, but with starkly different trajectories and outcomes.
Yeah.
It suggests this kind of microanalysis of clinical material could reveal dynamics missed in a broader review.
The potential applications are really intriguing. For supervision, imagine getting an objective signal from a scan that something might be going off track in the candidate's treatment.
Right, like an early warning.
Perhaps before it's fully apparent clinically, like
Yeah.
with 50T1 before that critical summer break.
Or even as a tool for the clinician themselves, offering a kind of potential check engine light in near real time,
Correct.
prompting them to reflect on their own process and refine interventions as the situation evolves.
And, of course, for larger research efforts, tackling complex questions about what makes certain therapies effective, why some patients drop out, or understanding the intricate dance between supervisor, analyst, and patient.
The source is careful to mention the limitations, which are important.
Absolutely. This was an exploratory study.
Yeah.
Only 2 detailed case examples out of the 14.
Right, just 2 illustrative cases.
And they acknowledge these cases differ in many ways, genders of therapist and patient, the historical era of treatment. They stress the need for replication with larger, more diverse samples.
And there's the complex question of correlation versus causation,
Sure.
Does the language measure cause or predict the outcome, or do successful clinical shifts lead to changes in the language the analyst uses in notes?
Good question. Chicken or egg?
It's likely a complex interaction, and more fine-grained analysis is needed.
Right. But the source reminds us that treatment failure, even in highly trained settings, is unfortunately common.
It really is.
And accurately predicting outcomes or identifying who is analyzable is incredibly difficult. We saw that with 50T1 starting as an excellent candidate and 70T3 seen as a difficult case, yet their outcomes were reversed.
Exactly. Prognosis is tricky.
This kind of process research is exactly what's needed to understand why.
And using clinical notes as the data source is practical. They're already being created, making them more available and easier to analyze than transcribing hundreds of hours of session recordings.
Definitely cheaper and faster, I imagine.
Much.
So what this deep dive into therapy notes shows us is that even in the most human and subjective of endeavors, understanding and working with the mind, objective analysis of something as subtle as language style can offer a powerful new lens.
Yeah, a different kind of insight.
It can potentially highlight crucial moments and dynamics that might otherwise remain unseen, offering clues to the complex path of therapeutic change.
It adds a fascinating layer of data to the deeply human process.
It really does. And it leaves you with this provocative thought. In a field built on empathy, intuition, and subjective experience, what does it mean that a computer might be able to spot crucial emotional dynamics or shifts in the therapeutic relationship that even highly trained clinicians in the heat of the moment might sometimes overlook?